Hi everyone. So today allow me to talk about prostate hyperplasia. This will be a bit longer, but if you would listen to the end, you will actually find out that you can manage prostate hyperplasia without losing your male erection. I want to share with you a story of Mr. Kato, a 62-year-old male who would wake up 5 to 6 times at night to just pass urine. Even after going those many times, he would still feel like there's some urine remaining in his bladder, and he would dribble urine. Sometimes he finds when his cloth was wet. This happened for a while because he was fearing the embarrassment of disclosing it to anyone. Well, by the time he came, actually he had developed urine retention. He couldn't pass urine, so we had to pass a catheter to relieve him of the pain. This is how prostate hyperplasia comes about. So the prostate is that organ that sits just below the bladder, and its function is in producing semen that helps to nourish the sperms. How does prostate hyperplasia come about? There's a hormone called dihydrotestosterone, which is sort of a breakdown of testosterone. So when you hear testosterone, you hear about male power. Now, these hormones increase, or this dihydrotestosterone increase, will result in certain part of your prostate enlarging abnormally, and also it promotes inflammation, chronic inflammation of the prostate gland. Now, as the prostate enlarges in that transitional zone, it actually compresses on the urethra, which is the tube that passes urine, and this causes sort of a strangulation at the neck of the bladder. Yeah, imagine my head is the bladder, prostate is sitting here and is enlarging inwards. So it strangulates it and holds urine in the bladder. That causes spasms, that causes people to like, oberanga yagola okufuka, ogendayo ngayenga there's no urine, or little comes out. But what is very crazy about all this comes when we are managing prostate hyperplasia. There are so many medications that are out there. They are effective, that is true, but they don't go without side effects. Many times, many people have complained that when I don't want to mention the drugs, when I use drug ABCD, I don't have my proper erection, like my manpower is lost. Yeah, because the hormone dihydrotestosterone, or the testosterone itself, is what gives the male power. But what if I told you STC 30 can help you reduce prostate enlargement without causing the side effects that the conventional drug would give? Of course, you can choose to use both. There's no problem. So this is how STC 30 will work in benign prostate hyperplasia. Remember, benign prostate hyperplasia is not the cancer one. The cancer is managed differently. So STC 30 will work in 4 major ways. 1, it will work at the hormone level. It will stabilize the level of dihydrotestosterone. In that level at which it will be enough to control the size of the prostate and also control your male power. 2, we mentioned inflammation as one of the ways your prostate misbehaves. Yes, so what STC 30 does is reduces those inflammation and also prevents or reduces oxidative stress, which comes about as a result of the continuous inflammation and reactions that occur. 3, we talked about the bladder having spasms or contracting multiple times unnecessarily. So there's a muscle in the bladder called the tricep muscles. So STC that will actually help you relax those muscles of the bladder and stop it from behaving in a way that makes you feel like you want to urinate all the time and yet you don't actually urinate. 4, STC 30 will help the coordination between the bladder and the urethra in 2 ways. 1, relaxing the sphincter muscle itself. 2, relaxing the prostate itself, and that's allowing the urine which comes with the pressure from the bladder to flow freely. Remember, STC 30 will not cause you any side effect with regards to male functionality. So you will keep your erection, you will be able to perform. So simply put, STC 30 will help the prostate calm down, shrink it, reduce its swelling, relax the urine passage, protect prostate cells, and help the bladder work better, so allowing urine to flow freely. I'm Dr. Albert, your super doc. Follow, like, and share. Let's learn together how to manage these conditions without having complications that arise from use of certain medications. See you next time.